Hello dear friends! Today I want to talk about breathing exercise. Breathing exercise can be very useful during today's situation, which have resulted in a large number of people worldwide suffering from severe lung disease, and who in spite of that have already recovered, still have a severe cough, shortness of breath, difficulty breathing, and weakness persists. Breathing exercise helps in opening alveoli, where mucus has accumulated thick, hard to cough up mucus. It helps to clean the lungs and enhance gas exchange between the lungs and incoming air, which results in enhancing not only the lungs condition but of the whole organism. For this case specifically, I suggest you to practice breathing exercise. I've seen on the internet many different techniques. I want to say that all breathing techniques are wonderful. Choose which one suits you better and practice, because every kind of breathing technique improves the function of the lungs, and all of them are worthy of respect. Choose which one you want. We suggest our technique for beginners who may find difficulties in navigation in the variety of techniques and don't know how to do breathing correctly, from where to start and how to practice the technique. So we suggest a breathing exercise which focuses on the technique of breathing, and with gradual introduction into this technique and gradual mastering of this technique and of the breathing exercise. So I ask you to pay attention when you will do the breathing technique. There are going to be several situations when you will need to make some effort, but treat it like a game. Don't push your body, never leave the comfort zone. And for long, never leave. It's a game, very good game. With time, when you will master some basic techniques, this is going to be entertaining, and maybe you will feel that you want to become better at it. But don't keep the exhalation until you faint. Don't inhale in a way that you will feel dizzy. Don't bring your body into a shock. Do everything playfully and with joy. Based on our experience, after 3 to 4 days of classes with a doctor, the patient masters the basic principles of our breathing exercise and can practice this method on their own at home. There are surprising results after mastering the technique. Some people notice that they sing better. Some people tell that they started to see colorful dreams. However, I always believe that all people see colorful dreams. In my experience, there was a young woman who had prolapsed pleuritis, was getting ready for a pleural puncture of the pleural cavity to drain the fluid, and after a serious attending of all classes and practicing breathing techniques based on our method, in 4 days there was nothing to drain. I was watching her for a couple of months after her practice of breathing techniques, and I can say that there is no need for puncture, I hope forever. About many of our students, who are mild asthma sufferers and use inhalers, After 3 to 4 days of practicing breathing method, stopped using the inhalers, and this was happening quite often. And I want to mention one more time, no amount of breathing exercise can counteract the treatment prescribed by the doctor. This can be used only in parallel and only by helping each other. This is what I wanted to tell you about breathing exercise. And I want to give an advice to beginners. It doesn't matter on which method they are going to practice. The first main advice to a beginner is just start. For your convenience, we separated our learning method of the breathing exercise into several lessons. After first lesson, we continue with the second. After with the third, and etc. And I want to mention that many athletes who did sport in the past and even yoga, they can distinguish by themselves the belly breathing and the chest breathing. They can't change in between one type of breathing to another by themselves. It was a revelation for me when I started to study and practice breathing methods. This was the difficult part, to teach how to distinguish belly breathing and chest breathing, and how to use them both. Our goal is to learn to distinguish belly breathing and chest breathing. This is the first thing that we have to do. Later, everything will be easier. If you won't understand something in the first lesson, you can try the second, and then return to the first again. There is no standard in learning. Everyone receives the information individually. That's why you don't have to put your body into a shock. This is a game which will bring you the best results. Thank you for your attention. We start with the first lesson.